Hi everyone, Dr. Antonio Roba here. I'm going to start out the new year with a discussion about metabolic syndrome. The main reason I decided to discuss metabolic syndrome is because I've noticed in my practice that patients have never heard of it, now for the most part. And the more worrisome aspect of it is that a lot of physicians don't recognize it when it's hitting them right in the face. They'll have a patient with diabetes or high blood pressure or prediabetes who comes in complaining of symptoms, and the physician does a full history and physical and orders labs. But when it's time to start treatment, he or she does not recognize that some of these patients that are diabetic, pre-diabetic, or hypertensive actually have metabolic syndrome. So I'd like to explain why it is so important to diagnose patients with metabolic syndrome. So by definition, metabolic syndrome is not a single disease, but a cluster of interconnected physiological, biochemical, clinical, and metabolic factors that directly increase the risk of atherosclerotic cardiovascular disease, type 2 diabetes mellitus, and all-cause mortality. It represents a state of chronic low-grade inflammation and metabolic dysregulation. That's why it's so important to diagnose it properly. Think of it as a perfect storm of risk factors that synergistically accelerate vascular and metabolic damage. The syndrome highlights the critical link between obesity, insulin resistance, and cardiovascular disease. Now, there is no single global standard, but the most widely used criteria require at least 3 of the following 5 components. 1, abdominal obesity. Waist circumference in men greater than 102 centimeters or 40 inches. In women, greater than 88 centimeters or 35 inches. Ethnic specific cutoffs are now strongly recommended. 2, elevated triglycerides greater than 150 milligrams per deciliter. 3, low HDL cholesterol, men less than 40 milligrams per deciliter, women less than 50 milligrams per deciliter. 4, elevated blood pressure greater than 130/80. And 5, elevated fasting glucose greater than 100. If 3 out of these 5 criteria are met, somebody that has it will be diagnosed as having metabolic syndrome. The syndrome's roots are complex and multifactorial, but several key mechanisms are central. 1 is insulin resistance, which is the cornerstone. Impaired ability of insulin to promote glucose uptake in the muscle and fat and to suppress liver glucose production leads to compensatory increase in insulin, which drives many other abnormalities like sodium retention, sympathetic nervous system activation, increased VLDL production. 2, adipose tissue, the engine. Not all fat is equal. Visceral or intra-abdominal adipose tissue is highly metabolically active. It releases what's called non-esterified fatty acids, which flood the liver, promoting liver insulin resistance, gluconeogenesis, and triglyceride synthesis. Pro-inflammatory chemicals called cytokines, adipokines, create a state of chronic inflammation leading to reduced secretion of beneficial chemicals, which improve insulin sensitivity, and also increased secretion of leptin, which contributes to resistance. This creates a vicious cycle of liver toxicity and glucose toxicity, damaging pancreatic beta cells, muscles, and liver. 3, dyslipidemia, characterized by high triglycerides, small dense LDL particles, and low HDL. 4, hypertension, due to sodium retention, sympathetic nervous system overdrive, and damage to inner linings of the arteries. And 5, pro-thrombotic and pro-inflammatory states, which leads to increased clotting factors and chronic inflammation marked by elevation in hs-CRP. So why does metabolic syndrome develop? One is genetics, strong familial predisposition, in some cases polygenic, many genes related to insulin signaling, adipocyte function, and inflammation are involved. Two, lifestyle, eating energy-dense, nutrient-poor diets, high in refined carbs, sugars, and saturated trans fats is a problem. Two, physical inactivity, reduces glucose disposal and metabolic flexibility. Sedentary behavior has independent negative metabolic effects. Aging is another problem, which causes natural decline in insulin sensitivity and lean muscle mass. Hormonal factors like polycystic ovarian syndrome and menopause. Other causes are low birth weights, certain medications like antipsychotics, and sleep disorders like sleep apnea. Now, what are the consequences of metabolic syndrome? The presence of metabolic syndrome approximately doubles the risk of cardiovascular disease and increases the risk of diabetes by about 5-fold. Accelerated atherosclerosis, coronary artery disease, myocardial infarction, stroke, heart failure are a consequence of this. In the case of diabetes, the progressive beta cell failure on the background of insulin resistance. Other associations, non-alcoholic fatty liver disease, which can progress to steatohepatitis and eventually to cirrhosis or liver death. Consider the hepatic manifestation of metabolic syndrome. Chronic kidney disease via hyperinfiltration, endothelial damage, and hypertension. Obstructive sleep apnea, polycystic ovarian syndrome, and certain cancers like colorectal, breast, and endometrial are linked to chronic inflammation and hyperinsulinemia, cognitive decline and dementia, vascular and possibly Alzheimer's pathology. So in summary, metabolic syndrome is a high prevalence, high impact condition that serves as a critical warning sign for future serious disease. Its pathogenesis centers on visceral adiposity and insulin resistance, which spawn a cascade of metabolic, hypertensive, and pre-inflammatory disturbances. Management requires a paradigm shift from single risk factor treatment to a holistic lifestyle-centered approach aimed at the root causes with pharmacotherapy, increasingly offering multi-target solutions. Early identification and aggressive interventions are essential to curb this substantial personal and global burden. Hope this was helpful. More to come.